Welcome to Health Talks.
Today's health talk will be focusing on men's health. Men have special nutritional needs. Men do need to pay attention to their own set of nutritional demands as well as women. Many problems caused in part by nutrition are common to both men and women, such as cardiac disease, obesity, and diabetes. In general, nutritional requirements in men are greater than in women simply because men as a population are larger and have more muscle mass than women. More calories. Men's calorie needs are greater. Those needs are dependent on the amount of lean body mass and average about 14 calories per pound of lean body mass per day at rest, with additional calories when exercising. A typical 180-pound man who has 17% body fat would have 150 pounds of lean muscle and would need 2100 calories per day at rest. Differences. These are driven by reproductive hormones. In men, testosterone is responsible for muscle mass differences from women, and this hormone accounts for the extra muscle driving extra protein and calorie requirements. Normal levels of circulating red blood cells are higher in men than in women, which may have nutritional implications because men do not tolerate low levels of plasma glucose or hypoglycemia as well as women. More protein. To build muscle mass, men might want to increase their protein levels above the regular daily requirements. To determine your optimal protein needs, divide your weight in pounds by 2.2. The ending figure is a good upper figure for the amount of protein you need. For example, they say a 32-year-old man who weighs 180 pounds who wanted to increase his lean muscle mass should eat up to 82 grams, his weight in kilograms, daily. We have this idea that it's easy to get too much protein, but really men who are active and want to maintain muscle mass need to eat more protein than they might think. Often we turn to carbohydrate-heavy meals in the evening. Carbohydrates are satisfying and taste good, but men are better off eating the majority of their protein at dinner, which helps their bodies rebuild muscle tissue overnight. Age affects men's nutrition. Metabolic rates decrease as age increases, and physical activity also decreases with aging. Thus, energy needs tend to be reduced with aging. However, good quality protein and vitamin and mineral needs continue to be very important. It is important for diets to be more nutrient dense as men age. Quality nutrients are important to maintain men's immune function and overall health, as well as preventing bone loss, eyesight loss, and muscle loss, and prevention of oxidative damage, as well as providing maintenance of tissue health via antioxidant minerals and vitamins become even more important as men age. Calcium is vital. Calcium is as important for men as it is for women. Men's needs for calcium is often overlooked similarly between men's and women's nutritional needs. Osteoporosis tends to be looked at as a women's disease, but this is not always the case. In fact, 1 in 4 men over age 50 will have an osteoporosis-related fracture in his lifetime. Exercise. Exercise must be part of a man's regimen to help maintain lean muscle mass. Part of the reason we see less lean muscle mass among older men may be because there is also a decrease in the number of men who do weight training as they age. Exercise can help maintain muscle mass and help maintain a fast metabolism as we age. Number one killer of men: heart disease, from the CDC. Heart disease and strokes are the world's biggest killers, accounting for a combined 15 million deaths. These diseases have remained the leading causes of death globally in the last 15 years, year after year. Men, stay healthy. Get the screenings you need. Screenings are tests that look for diseases before you have symptoms. Blood pressure checks and tests for high blood cholesterol are examples of screenings. You can get some screenings, such as blood pressure readings, in your doctor's office. Others, such as colonoscopies, a test for colon cancer, need special equipment, so you may need to go to a different office. After a screening test, ask when you will see the results and who you should talk to about them. Colon cancer. Have a screening test for colorectal cancer starting at age 50. If you have a family history of colorectal cancer, you may need to be screened earlier. Several different tests can detect this cancer. Your doctor can help you decide which is best for you. Depression. Your emotional health is as important as your physical health. Talk to your doctor or nurse about being screened for depression. Diabetes. Get screened for diabetes. High blood sugar if you have high blood pressure or you take medication for high blood pressure. High blood cholesterol. If you're 35 or older, have your blood cholesterol checked regularly with a blood test. High cholesterol increases your chance of heart disease, stroke, and poor circulation. Overweight and obesity. The best way to learn if you're overweight or obese is to find your body mass index, also known as the BMI. You could find your BMI by entering your height and weight into a BMI calculator, and this gives you a good estimate of what your BMI is and whether or not you're overweight. Now, some factors can be considered, like if you have a lot of muscle mass, you can have a higher BMI but still be healthy. Get preventative medicines if you need them. Aspirin. If you're 45 or older, your doctor or nurse can help you decide whether taking aspirin to prevent a heart attack is right for you. A small dose of aspirin every day thins out the blood just enough that it helps prevent clots and helps you avoid a heart attack. Vitamin D to avoid falls. If you're 65 or older and have a history of falls, mobility problems, or other risks for falling, ask your doctor about taking a vitamin D supplement to help reduce your chances of falling and also help keep your bones stronger. Exercise and physical therapy may also help. Immunizations. Get a flu shot every year. The older you get, the more susceptible you are to the flu. If you're 60 years older, get a shot to prevent shingles as well. Shingles is also a reoccurrence of the same virus that causes chickenpox. If you're 65 or older, get a pneumonia shot. Pneumonia becomes again increasingly more dangerous to those people who are older. Get a shot for tetanus, diphtheria, and whooping cough. Get a tetanus booster, especially if it has been more than 10 years since your last shot. Talk with your healthcare team about whether you need other vaccinations as well. You can also find which ones you need by going to www.cdc.gov/vaccines. Take steps to good health. Be physically active and make healthy food choices. Get to a healthy weight and stay there. Be tobacco free. If you drink alcohol, have no more than 2 drinks per day if you're 65 or younger. Live healthy, be healthy. This has been a presentation from dietarypathways.com. Contact us for your free consultation and health assessment.